We are here right now with the wonderful Dr. Jonathan Tarbox. He is the director of, of the Autism Research Group.
Correct.
But you are also the head of research and development here at the Center for Autism and Related Disorders. Both wonderful and illustrious titles.
Thank you.
And we're talking with him right now about different ways that ABA is used aside from autism and some of the different research that's been done in areas outside of autism. Why, you ask, would we talk about that? Because it's kind of fascinating, and I think it's great to see. We've been talking all week long about how you want to have a tool belt for ABA, that it's not like it's this thing where it's step one, step two.
It's not a cookie cutter recipe at all. Yeah, it's about basic principles, and it's about a general way of looking at the world, and the ability to, in fact, to be a good ABA provider, and frankly, to be an effective parent, you need to be able to apply what you understand about ABA in general to new situations, and not just follow, oh, we're supposed to do this step, repeat, repeat. It's about being creative and flexible.
Yeah, I'm coming to think of it a lot like painting. That you get the tools, and you see that there are some different techniques that create different effects, but then you have this canvas, and you have to apply things in the way that makes sense to you.
That's exactly right. You're not painting the same tree over and over.
Right. I could just hear Bob Ross saying, "A happy little tree."
I loved Bob Ross.
Great. Wasn't he awesome? And he showed you techniques, right, that you could practice, but then you needed to apply it in your own way.
Exactly.
And he would never have said to you that all trees are the same or that all rocks are the same. Happy little trees, happy little rocks. And so that's what we want to do, is get the tools, gain the tools, apply the knowledge, and then get creative with this science and apply it to our individual, not cookie cutter child.
That's right.
Individual.
And our own lives as well.
Absolutely. And I think that's one of the things that's exciting to me about this, is that, it expands your mind a little bit, and you think, okay, so where else could we be using this?
That's right.
With my mother-in-law. My mother-in-law is not with me. But with my dog.
Seriously. Well, and actually, it's funny you say mother-in-law. I actually did a little experiment with my grandmother years back, where she was the type that would call and nag and complain constantly, right? And her sort of mantra was, no one pays attention to her enough, and people wouldn't call her enough, people wouldn't give her enough attention. And so every time, and so we never called her, like typical lousy grandchildren, we never called her. But then when we did talk to her, she would just complain the whole time. And so I thought, well, wait a minute, hang on. From an ABA perspective, what does she want? She wants attention. Right? Well, what if we just gave her more attention when she wasn't calling us and nagging us?
Right.
So I started a schedule of calling her once a week. I think it was every Monday. And she didn't have to ask, I just did it.
Right.
And I did that, and within maybe 1 or 2 weeks, her complaining went down to 0.
Wow.
And every time she talked to me, or she talked to us at our house, it was all positive. And it was just nice to see you. Thanks. And she didn't keep us on the phone forever, because she was getting what she wanted. So she didn't have to do the problem behavior to get it, right? It was kind of funny, though, because she still complained to other people about them, but never complained to us. So.
Right.
But
they weren't giving the attention.
Right, yeah, they weren't doing the treatment.
So it kind of makes sense, yeah. They weren't following through. Well, that kind of makes sense. And when we see parents who say, one parent is applying the rules and being very specific about it, and the other parent stands there and says, well, why is he or she doing it for you? And they're not, well, you're not applying the tools.
Not following through,
and sometimes it's tough to hear that. I was sharing earlier that, we've had to send our dog out to a behaviorist. And so we got to go and visit and walk the dog, and we're being trained now. And I couldn't believe how hard I was finding it to be, because they're new set of rules. I'm used to reacting in a certain way, new phrases to say, and we all had to take our turns to it. And I felt like I was in, remedial ABA with the dog. And
you probably knew more about behavior analysis than the dog trainer did.
I don't think so. But knowing about it and being able to apply it in the situation when you have a pattern, it is. And I kept on, and he was being very patient with me and saying, now, she just did the thing. You have to reinforce immediately. It has to. And I was going, I know this, but it's just a matter of being able to do it. I got to get myself situated. It's going to take me a little while, and being patient with myself. But it was very reinforcing. Boy, that dog was stopping and sitting, and
it's working.
And
great.
It was working beautifully. It's crazy. She gets to come home soon.
All right.
Wonderful. So in any case, but you were telling us things that different ways, research
other
that's been
applications.
done. Yes.
Other areas of ABA.
So what else on your list?
Got a list here. there's a whole area of ABA called organizational behavior management.
I noticed that at the conference.
Yeah, it's quite a bit of research in that area, and basically it's application of behavioral principles to solving problems in organizational settings. So instead of looking at necessarily the behavior of one person or one organism at a time, it's looking at sort of behavior overall within a group or an organization. And so, you know, again, there's lots of different research in that area, but the number one thing that it keeps coming back to is goal setting and feedback. And so, you know, again, if you want to change someone's behavior, give them clear, meaningful consequences frequently, right? So they look at things like, you know, traditionally when people talk about work culture, sort of people make up all kinds of sort of constructs and myths and stuff about, oh, this, about the culture and leadership and all kinds of other kind of fancy sounding ideas. But then when it comes down to it, what do you really do? And it turns out that effective leaders set goals with their employees and they give them frequent feedback and an honest feedback, right? So, you know, there's lots of research on increasing productivity in organizations, decreasing different types of behaviors that might be bad for the organization, increasing safe behaviors. There's quite a bit of research. It's called behavioral safety research, and it's things like, you know, making sure that employees lift with their knees, not their back, wear seat belts when they're driving a dump truck, that type of thing. And basically it comes down to the same thing. It's about getting clear feedback and setting goals, and actually they incorporate things like observing other employees. So part of what changes my behavior is observing whether other employees are doing the behavior. So they'll have all the different workers on a particular unit take data on each other's behavior. Is Jimmy, you know, lifting with his knees instead of his back? And Jimmy takes data on their behavior too, and we all just kind of, it's feedback for all of us essentially.
Right. But I could see where it would make it more present in your mind.
Sure.
If you're watching other people and knowing that they're watching you might be more likely to be safe.
Yeah, and it's not punitive. It's not like you're, you know, writing someone up so they get in trouble. That's not it at all. In fact, the data have no real consequence. The only real consequence is it gives you feedback on your behavior and your colleagues' behavior. So there's some very effective stuff. Actually, when I was in graduate school in Reno, one of my professors was doing this kind of work in a big open pit mine up in Nevada, and, you know, they drive these trucks that are, I don't know, 20, 30 feet tall. They're literally like a two-story house, the size of these dump trucks. And, you know, traditionally a lot of the drivers don't necessarily wear their seatbelts. It's kind of a macho thing or whatever. So this professor of mine had gone in and done a behavioral safety consultation. And it actually worked, and so he increased seatbelt use. And a month or two later, one of the dump truck drivers actually rolled the dump truck down this massive hill. Probably would have died if he wasn't wearing a seatbelt, but he's wearing the seatbelt. And he actually gave that feedback to the professor, said, hey, I probably wouldn't have been wearing my seatbelt. I never used to before. So he might have saved that guy's life.
Yeah, and what did he do to encourage them? What was the reinforcement that they got?
Feedback.
Just feedback.
Just feedback. Yeah, and goal setting. Oftentimes you'll say, okay, so the goal for this department or this unit or this crew or whatever is at least 80% or 75% compliance with whatever safety behavior it is. And you take baseline data first, so you see where folks are at first, and then you set goals, reasonable goals that are slightly higher than your current level of performance. And each week maybe you increase the goals a little bit, and it's just feedback. When people get clear feedback from their supervisor, it changes their behavior. But the feedback has to be honest, and it has to be frequent. And you can't sort of let underperformers get away with not hearing that they're underperforming, and you can't let good behavior happen without also giving good feedback. It's not just about criticizing, it's about, hey, you did that perfectly. That's exactly what we're looking for.
Right. Well, we should be clear that feedback and nagging are two entirely different things.
That's a really good point. That's exactly right. Yeah.
Because I participate in the nag thing.
Everybody does.
I know it's my go-to, Jonathan, and it's something that I'm working on. But what I hear in that is that I don't have to nag, but I could give feedback.
Yeah.
But that it's clear, it's got to be clear, and just saying this is where we are on this, so there's room for improvement, and then not revisiting it endlessly.
That's right. And then when improvement happens, make sure you acknowledge that.
Yes,
that's the really important part.
That's the really big thing. I was just thinking about the fact that I was at Home Depot last night, and you know how a lot of times now, businesses and organizations, you'll go through and you get your receipt, and they'll say to you now, and they circle on the bottom of the receipt and say, there's a survey that you can take to say what your experience was like, but there is that delay, right? Because then you have to go home, you have to remember, you have to, how many people do that, and then that goes to corporate, and corporate has to sort out, and a month later they, say to the employee, you had a bad experience with a person. There's a huge delay, right?
Yeah.
Well, now at the Home Depot, they had this thing now that you go through the register, and there's a bell at the end of the register at my Home Depot, and it says, if I did an awesome job, please ring the bell. And if you ring the bell, then everybody cheers, and the person gets immediate feedback from the supervisor saying, hey, great job, you know, and you feel as a person that, you know, you gave the feedback. And so I thought that was kind of clever.
Yeah, and if they treated you really well and you appreciate that, it probably feels great to give them that feedback, right? So that's neat.
And to see that, and you're there when you see them get
convenient and immediate. Yeah,
I thought,
really smart.
That's kind of clever.
Yeah.
We like Home Depot. Well, no, because they have that kids craft thing
right.
too.
You were telling me about that. Yeah.
It's a really amazing thing. We just showed it a little earlier, and that's coming up next weekend, not this weekend. That people can go for free and work on a craft with your child. It's really fun.
Very cool.
It's great for our kids. Okay, so what else do you? And you brought up behavioral safety a little bit.
Yeah, we talked about that a little bit. Another really interesting area of research is in drug addiction. There's some folks at Johns Hopkins Hospital in Baltimore doing some really interesting research, actually with some of the most difficult populations to work with. These are folks who are mothers and addicted to at least 2 different drugs, usually cocaine and heroin. And the treatment procedure, and these are usually folks who, because of their substance abuse problems, aren't able to keep a job, you know, and of course aren't really able to provide for their kids. And so it's called a therapeutic workplace, and what it is a workplace where they have very simple jobs that pretty much anyone can be trained to do, usually data entry or something like that. But there's a contingency. You can only have this job if you show up and you're clean and sober. And so they actually make them urinate in a cup for a drug test. You know, I forget how often, maybe once a week, come through the door, urinate in the cup, and if it's dirty, you don't get to work here. And so it's a very simple contingency of you're going to be able to support your family if you don't do the drugs. And it's amazing. It has over a higher than 50% success rate of keeping people off drugs. And these are people who are addicted to cocaine and heroin, very serious.
And if you see statistics on when people have those issues of you know, who can be helped, that's amazing.
It's very 50%. High. Yeah,
that's very high.
Yeah.
That's amazing. What a wonderful group of people to be working with in that way.
Yeah, it's exciting stuff.
And how, you know, how immediate that is too. I know a lot of people think that testing for drugs is just this, you know, really intrusive and horrible thing, but if somebody is at that point and it's working to help them to stay clean and
what's
sober,
more ethical?
Because it's clear. It's not like, oh, well, maybe I'm going to get a drug test or maybe I'm not. You know that if you're going to use, it's going to show up because they are going to test you.
Yeah, and if you want to provide for your kids, if you want to have a job, here are the rules, period. Plain and simple. Plain and simple.
Okay.
You know, there's some folks in, it's a county in England, actually, paying people for not smoking. Have you heard of this?
No, but I love that.
It's really interesting. So what they did was they calculated the cost to society of smoking. And it's huge. It's enormous, right? Because folks get lung cancer, they get emphysema, and then of course the healthcare system has to take care of it, right? So they calculated what the cost was to society for smoking, and then, you know, took, I forget, like one 100th of that or something like that, and said, let's just pay that to people for not smoking. And so you show up to the county health department office or whatever, you breathe into a tube that measures carbon monoxide level in your lungs or something like that, some measure of how recently you smoked or if you smoked. And as long as you're below some level, they just give you money. Just give you $10, $20 or whatever.
Love that.
It's brilliant. It's so simple. Right?
I love that.
And of course, some people are like, oh, well, how dare they? That's tyrannical. They're encroaching on our freedom.
You don't have to participate.
Yeah, then don't participate. Yeah.
I love that because, you know, I had a bet with someone near and dear to me here that last fall because I really wanted them to stop smoking, and so the deal was, and I'm supposed to be exercising. This is where we need to apply the ABA rules, and we've not quite cracked that nut yet, can we just say? And so the deal was that every day that I exercised, that person couldn't smoke the next day.
Okay.
And that was the deal that we worked. We said this will be reinforcing enough for both of us. And it was brilliant. It was absolutely fabulous. I think I worked out, you know, for like 3 straight weeks, and I was feeling better. And then that person shared that they had given up smoking forever and they weren't going to go back to smoking anyway. went, and that was it.
Oh, no.
That was like the last time that I exercised.
So there's no meaningful consequence for you anymore.
For me anymore, and they're still not smoking, and I'm thrilled about it. But it went out the window. So and I needed to change what was reinforcing to me at that moment, but not exercising was more reinforcing than changing the reinforcer.
That's right.
So, yes, I'm big on let's get everybody to stop smoking because it's horrible.
Yeah.
I'm an ex-smoker, and way long time ago, and we're the worst. We're the least tolerant people in terms of that. If I can quit smoking, then I sort of feel like everybody can quit smoking because it took me 3 times, and it's terrible. It stinks. It's bad for everybody's health.
Public health disaster.
It is.
Yeah, it really is.
It is. And it's expensive.
Very expensive now. Yeah.
Somebody was talking on NPR about having to go and buy a carton of cigarettes because they were going to a foreign country and they were going to use them to barter, and they said that they bought 2 cartons of cigarettes and went up to the counter, and the person was asking for like $180, and they thought it was a mistake, and it wasn't.
Wow.
It's that expensive.
Wow.
So,
well, if I understand it correctly, increasing the price of cigarettes does decrease consumption.
Does it?
At some point, yeah.
Okay.
Once it reaches some level, and I'm not an expert on
like
that.
$1,000 a carton, maybe is what we need to set it at.
Yeah, but I think it does have an effect. So,
okay. All right.
There's some
That's good to know.
for that. Yeah.
All right. So people should stop. But in any case, so what else? We should take a break. Let's take a break because I have digressed to the point. Let's take a short break, and we'll come back and talk about a couple of more things with Dr. Jonathan Tarbox. Welcome back to Autism Live. I'm having so much fun here. I got to remember that, keep doing what we're supposed to do.
Stay on task.
Stay on task because I'm having so much fun talking about what we're talking about. So we are talking about research and ABA when it doesn't apply to autism.
Right.
Because sometimes it doesn't. Although I think everything relates back to autism at some point.
Right.
We can use this information.
That's right. And that's the neat thing about ABA is the general principles relate to everything that we do with ourselves, with everyone that we interact with our children, whether or not they have an autism spectrum disorder. So,
and if this is the ballpark that we have to play in, and we didn't pick this ballpark, but here's where we are, then we might as well use it for beneficial things that don't have to do with our child on the autism spectrum. So, if it can help us to have a more productive life at work, if it can help us to be happier in ourselves and our bodies, healthier, then why wouldn't we use it?
Absolutely.
It only makes sense. So we're going to talk a little bit, since we were talking about exercise, which I love to talk about. I just prefer not to do it. But you have some ABA research.
So, there is a little bit of research on
exercise.
that. Yeah, a few different.
That might help me.
Few different areas of application. One actually is a recent study by Ray Miltenberger and colleagues. What they looked at was they called exergaming or exercise gaming, and it's where they connect video games to exercise in some way.
Love it.
And what they found was basically that linking video games with exercise, they compared that to traditional PE class, and what they found was when children were playing video games during exercise, they actually did more exercise than if they just participated in a regular PE class.
Okay.
So your traditional thought might be, well, video games are terrible for exercise, right? But if you do things like, like the Nintendo Wii that requires movement, and they also have video games now that are attached to a exercise bicycle, and so the video game only works if you're pedaling the bicycle.
That's what I need.
Right? Yeah, me too. So they actually found that actually produces more exercise than just standard PE. So that's pretty exciting.
That is very exciting. And I would imagine that at some point that's going to revolutionize how we look at PE in schools.
One would think so. And, it's not like we want everyone just burying their head in a computer all the time. But if it works better and it's probably cheaper, it's got to be cheaper, right?
I would think so.
Then why not motivate? If it helps motivate kids to exercise, why not?
And no research yet on adults to do with that.
Not that I'm familiar with, but maybe that's the next step.
All right, because I years ago I said if you hooked it up to even my television, hooked up to the television, and I couldn't watch an hour of televition unless I was doing 20 minutes on a treadmill.
We all
or
need
on a bicycle.
That, right? On an elliptical trainer or something, right?
It would make it. My life would be much different. A really interesting thing. And And so all of these different things that we've talked about, really amazing for us to take the kernel of knowledge and be able to apply this in the different ways that we can. You also mentioned anxiety and
there's a very exciting area of application of ABA called acceptance and commitment therapy. It's developed by Steve Hayes and colleagues at UNR, and now it's spread all over the world. There's something like 5,000 different people now who belong to the professional association that are involved in acceptance and commitment therapy in some level or in some way. And basically, it's an ABA approach to psychotherapy. And so people sort of traditionally think of ABA as being totally separate from traditional psychology and psychotherapy, but there are actually ABA approaches to psychotherapy, and ACT, or acceptance and commitment therapy, is one of these approaches. There's a lot of good research now, something like 30 randomized controlled trials showing that ACT can be successful, can be very effective in treating anxiety, depression. I think they've done research on decreasing substance abuse as well. Treating chronic pain even.
Wow.
Apparently a lot of the ways, and I'm no expert in this, but a lot of the ways in which people experience chronic pain have to do with their thoughts and the rules they tell themselves about the pain.
Really?
Yeah, and so there was a great study coming out of, I think it was Sweden or Denmark, that showed through acceptance and commitment therapy treatment, they could decrease the number of days that individuals with chronic pain stayed home from work. But they also, this is the interesting thing, they also measured the pain that they're experiencing, and it didn't decrease the pain. It just taught the person to be able to live with it better and to be able to get on with their life better. So it's very interesting,
And ACT is something that we talk about frequently when Evelyn Gould comes in to visit with us on Wednesdays at 10 o'clock as a way of finding all the different ways to deal with the anxiety and the stress and the pressure that come with being a parent of a child on the spectrum. And she would never forgive me, because there's a wonderful book that we talk about all the time that's written by a father who is an ACT practitioner who happens to also be a dad.
It's called The Reality Slap.
The Reality Gap. Slap? It's the reality slap. Why did I think it was the gap?
Because he talks about a reality gap as when life is different from what you expect it to be or need it to be. That's the gap, right? But when you get a big gap, it's a slap, basically.
So the reality slap.
The Reality Slap by Russ Harris.
Russ Harris, that's exactly it.
It's a great book.
And it's a book about ACT.
But for parents. Well, actually, really for anybody who's facing a major challenge in their life.
It's just coincidental that he is the father of a child with autism and relates his story within the context of how ACT works.
Exactly.
Which is a great gift to those of us who...
It should be really, honestly, mandatory reading for anybody with a child on the spectrum.
So a wonderful, wonderful thing. And all of these things are because of this wonderful ABA science. And we can gather these tools and learn how to apply them and figure out with our individual child what the best way. I am really, I feel like I've had a love affair with ABA for a long time, from the first time that I saw my child improve. But as I'm learning more and more about how this is applicable in so many different, I feel like I'm falling in love again.
Maybe it's time to go back to grad school. Get your BCBA.
That's not happening. That is not happening. Although Dr. Dorsey keeps saying to me, you can get a master's degree in autism.
That's right.
I keep saying, I think I already have a master's degree
one at this point.
in autism in terms of life. I don't know.
Maybe when Jim goes away to college.
When I go to college with him, you mean? That's the rating joke that we always talk about. Where is he going to go to college? And it changes from time to time. I think for a long time it was MIT that he was going to go. And we always say, Mommy gets the apartment around the corner. And what's funny to me is he always says, well, where is Daddy? And I say, Daddy can come. Daddy's allowed.
He's invited.
He's invited if he chooses to come. But Mommy will live in an apartment around the corner. It's just, I just keep putting that in there so that when it happens, it won't seem unusual to anybody. Okay. Well, thank you so much. This has been so enjoyable. We'll look forward to having you back next week. Will you be with us next week, or are you away on holiday?
I will be with, I'll be here.
All right, fabulous.